Flinders University is now delivering an intensive, multidisciplinary training course to a contingent of East African fellows in a bid to reduce infant and maternal mortality in developing countries. A group of 33 delegates from a range of organisations in South Sudan, Tanzania and Ethiopia arrived in Adelaide in January to begin the 6-week course, which is funded through the federal government's Australia Awards fellowships. As the largest African contingent to take part in the program, the delegates are learning practical skills across a broad range of public health disciplines, while being supported to develop plans to improve their home institutions' approach, policies and practices to child and maternal health. Flinders public health physician Dr Lillian Wanry, who's leading the project, together with Flinders developmental psychologist Dr Julie Robinson, says the fellows have been selected to match specific areas of need within their countries.
These fellows have come from 3 countries, South Sudan, Tanzania and Ethiopia, and these countries have got a variety of problems, particularly the high prevalences of maternal and child health. Because these countries have got different levels of development and different levels of maternal and child health problems. Some countries are much better off and others, so what we are doing is to build the capacity within the country and also between the countries so that we develop a network of people and resources which they can share when they go back.
Program participant Dr Afina Mramba from the Tanzania National Health Insurance Fund says she hopes to apply her newfound knowledge to build capacity among colleagues in her home country.
It's really capacity building on how to reduce maternal mortality and improve child health. So we're learning how we can, from our day-to-day job, how we can incorporate what we do in attaining the reduction of mortality in women and children.
Dr Rufus Ambrose Bojo says he thanks Flinders University for the opportunity to learn new strategies to improve the health outcomes of his patients at the Kajokeji Clinic in South Sudan.
We can work on how to improve the maternal mortality rate in the hospital that I'm working by targeting some areas, maybe targeting areas of family planning, training of midwives, and upgrading of the traditional birth attendants. Or either we can give them usually workshops and whatsoever so that increase their capability, and then that one will affect positively and it will reduce the maternal mortality rate.
Esito Bekele, the Executive Director of the Poverty Action Network in Ethiopia, says he hopes to use Australia's best practice approach as a model when appealing to the Ethiopian government to make health a priority.
I have identified already very important and interesting areas how to advocate with the civil society, to hold government to account and put more money for the health sector, and as I said, more specifically for child health and maternal health.
The program is part of the federal government's commitment through the Australia Awards Fellowship towards achieving the United Nations Millennium Development Goals of reducing child mortality and improving maternal health. The university has now attracted further funding under the fellowships to host 2 more international capacity building programs over the coming months, one in nursing and one in disability care.